everyone, we can go ahead and get started. My name is Sophie Maria, and I'm a consultant with Guidehouse supporting CDC's One Lab initiative. A couple of notes about the webinar before we dive in. If you're having any technical issues throughout, please feel free to email the One Lab inbox for support at onelab@cdc.gov. If you have questions throughout the session, please insert them into the Q&A function below. We'll do a Q&A session at the end of the presentation where we will review your questions and do our best to answer. Please note that I've posted the link to the live captions in the chat, but please be sure to keep both the captions window open if you use it, in addition to the Teams webinar. The next slide. Today we'll start by going through some introductions, and then following the presentation, we'll have about a 10-minute Q&A session where we will review your questions and do our best to answer. Next slide. For today's webinar, we'll be leaving the chat feature open for your engagement. When utilizing the chat box, please keep in mind the appropriate rules of engagement. Feel free to use the chat to connect with others by reacting to what you're hearing, sharing your experiences, and asking questions to fellow participants. If you have a question for the presenters, please use the Q&A function and not the chat. Additionally, please engage with respect and professionalism. Any inappropriate language, improper conduct, or any form of discrimination may result in removal from the webinar. Please ensure your comments are relevant to the topic, and if a moderator gives direction regarding chat behavior, please comply accordingly. Lastly, please notify moderators if you experience technical difficulties or observe any disruptive behavior. I will now turn it over to our One Lab Network lead, Alicia Branch.
Thanks, Sophie. I'm excited to introduce our presenters for today, Cheryl Dovey and Karen Sutter. Cheryl Dovey is a technical advisor in the Division of Clinical Laboratory Improvement and Quality at the Centers of Medicaid and Medicare, the Medicare and Medicaid Services, with over 30 years of experience as a clinical laboratory scientist. She has been involved with the Clinical Laboratory Improvement Amendment Program at CMS for more than 13 years. Our next presenter is Karen Sutter. She is also a technical advisor in the Division of Clinical Laboratory Improvement and Quality at the Centers of for Medicare and Medicaid Services. And she also has over 30 years of experience as a clinical laboratory scientist. She has been a part of the CLIA program at CMS for more than 5 years, and she also has served as a CLIA state surveyor for over 6 years. Both Cheryl and Karen have dedicated more than 2 years to developing the Laboratory Director University, and we are excited to announce its launch. Over to you, Cheryl and Karen.
Greetings, everyone, and thank you for joining us. We are so excited to launch Laboratory Director University. When a patient visits a clinic for a routine checkup, a cancer screening, or a mysterious infection, one of the first steps is often a laboratory test. The provider collects a sample, sends it to the laboratory, and within minutes to days, the results arrive. What many don't see is the team of highly trained, CLIA-qualified laboratory professionals working behind the scenes to make those results accurate, timely, and clinically useful. At a CLIA-certified laboratory, accuracy is not optional. It's a requirement. Every technician, technologist, and supervisor undergoes rigorous training, education, and competency assessments to ensure they can properly handle specimens, run complex diagnostic equipment, and interpret data. Errors in a laboratory can lead to a missed diagnosis or a delayed treatment. That's why CLIA sets strict standards for who can perform, supervise, and direct laboratory testing. Next slide, please.
The Centers for Medicare and Medicaid Services, or CMS, Division of Clinical Laboratory Improvement and Quality, DCLIC, has partnered with the Centers for Disease Control and Prevention, CDC, and their Division of Laboratory Systems to develop a comprehensive program aimed to assist laboratories in their compliance to the Clinical Laboratory Improvement Amendments, regulations, enhancing the quality and reliability of clinical laboratory testing across the nation. Next slide.
There are two objectives for today's webinar. First, to describe the role and responsibilities of a CLIA certified laboratory director, and second, to summarize the purpose and scope of Laboratory Director University. During this webinar, we will address only those questions that pertain to the event's topic. For all other inquiries, please contact CMS Laboratory Excellence at labexcellence@cms.hhs.gov. Next slide.
With growing demands, evolving technologies, and heightened regulatory expectations, LDU was created to provide flexible, accessible learning opportunities for laboratory directors and all CLIA certified personnel, supporting every individual's role in maintaining high quality testing, strengthening laboratory operations, and ensuring compliance with the highest standards. Now we're going to play a short video explaining LDU.
Laboratory directors carry immense responsibility, overseeing operations, hiring qualified staff, and ensuring compliance with CLIA regulations. Most importantly, they are responsible for ensuring patients receive accurate, reliable test results every day. Laboratory Director University is a free training program offering self-paced, high-quality content and resources for current and aspiring laboratory directors. The Centers for Medicare and Medicaid Services, Center for Clinical Standards and Quality, Division of Clinical Laboratory Improvement and Quality, has partnered with the Centers for Disease Control and Prevention, Division of Laboratory Systems to develop this program. The e-learning course, CLIA Personnel Qualifications and Responsibilities, High Complexity Testing, featured here, is one of the many LDU-related resources to help laboratory directors improve laboratory performance and CLIA regulatory compliance. Join Laboratory Director University and discover the resources you need to help your CLIA-certified laboratory succeed.
Behind every result, there are hidden experts. For example, in a high-complexity laboratory, a technologist might be running a molecular PCR test to detect a rare infectious disease. Their training includes a deep understanding of molecular biology, quality control protocols, and result verification. They also participate in regular proficiency testing, which means their skills remain sharp and their work meets national standards. Moreover, qualified CLIA laboratory staff are not just trained once. They are part of a culture of continuous learning. Whether it's adopting a new COVID variant test or implementing digital pathology, these professionals stay at the cutting edge of science and technology because patients and providers depend on it. When a provider delivers results to the patient, those numbers and terms should come with the assurance that a highly trained laboratory team presented the findings. That's the power and the unseen precision of qualified CLIA laboratory staff. Next slide.
Under CLIA 42 CFR Part 493, the laboratory director is directly responsible for ensuring compliance with all applicable federal regulations. The lab director must also oversee quality assurance, proficiency testing, personnel qualifications, test method verification, and record keeping. The lab director must also implement and verify corrective actions when deficiencies are identified. If deficiencies are found during a CLIA survey, the lab director is expected to respond to the statement of deficiencies, which is also called the Form CMS 2567. They must develop and oversee an acceptable plan of correction or allegation of compliance, and they must ensure that the lab achieves and maintains ongoing compliance. If issues are severe or recurrent, CMS may sanction the laboratory. For example, there may be civil monetary penalties, suspension of testing, or even revocation of the CLIA certificate. CMS may also impose personnel sanctions, including banning the laboratory director from directing any CLIA certified lab. In severe cases, the director can be removed as laboratory director under federal enforcement actions, or they can be prohibited from serving in the role for a set period of time, depending on the violation's severity. While the laboratory director can delegate certain day-to-day duties, for example, to the technical supervisor, general supervisor, or technical consultant, they cannot delegate accountability. If someone under their supervision fails to follow policy or meet the CLIA standards, the director is still ultimately responsible. Next slide.
In a CLIA certified lab, laboratory directors play a critical role in ensuring the lab operates in compliance with federal regulations and maintains high quality testing standards. Their responsibilities are both administrative and technical, and they are ultimately accountable for the overall operation and administration of the laboratory. The laboratory director is responsible for overall laboratory oversight, which includes responsibility for the administration of the lab and ensuring that all operations comply with CLIA regulation, ensuring that qualified personnel are employed and properly trained, to maintain adequate staffing, space, and equipment for test performance, and provide or ensure the availability of consultation to clinicians regarding test ordering, interpretation, and utilization. For quality assurance and performance improvement, the laboratory director is responsible for establishing and maintaining a quality management system, ensuring the implementation of a quality control program for all testing, and reviewing and acting on proficiency testing results and the investigation of failures. The laboratory director is also responsible for personnel management, for ensuring that all laboratory personnel meet CLIA qualification requirements for their roles. They are responsible for delegating responsibilities to other lab personnel, such as technical supervisors or general supervisors, but the laboratory director retains ultimate accountability, and they are responsible for ensuring that test results are reported accurately and in a timely manner. The laboratory director is ultimately responsible for test method validation and selection. They are responsible for ensuring that test methods that are selected have performance specifications verified for FDA-approved tests, or for non-FDA-approved tests, that performance specifications are established. Additionally, they are responsible for ensuring that these test methods produce accurate, reliable, and timely results. For compliance and regulatory responsibilities, these include that the laboratory director must ensure the laboratory is in compliance with all applicable regulations, including federal or CLIA regulations, any state, and any applicable accreditation organization requirements. They must respond to inspection deficiencies and implement corrective actions. And they must ensure that all required records, including personnel qualifications, PT results, instrument maintenance, and test records, are retained for the mandated retention period. Next slide.
Laboratory Director University offers a free focus learning on the Clinical Laboratory Improvement Amendments of 1988 to address common deficiencies found during surveys of CLIA certified laboratories. CMS has partnered with the CDC to deliver this curriculum that provides the convenience of self-paced learning specifically for laboratory directors who manage overall operations, administration, and compliance in CLIA-certified laboratories. Every day, CLIA-certified laboratory professionals like you ensure accuracy, safety, and integrity in diagnostics. You are the standard. Through LDU, we are building on that foundation, equipping the next generation of laboratory leaders to not just meet the standard, but to shape it. This self-paced laboratory director learning pathways fills several critical gaps in the current landscape of CLIA laboratory leadership, particularly for aspiring or newly appointed directors in moderate and high complexity laboratories. Next slide.
LDU offers focused training for current and prospective CLIA laboratory directors, interactive tools that connect surveyors to training resources, scenario-based learning to reinforce practical application, pathways to successful competency assessment, and reassessment for failed areas. LDU gives lab directors the resources they need to enhance training for their staff in crucial areas of CLIA-designated personnel positions, helping to develop the knowledge, skills, and abilities to perform optimally in their roles in a CLIA-certified laboratory. Next slide.
The LDU instructional approach includes both core and supplemental features. We anticipate including continuing education credits for LDU. LDU's learning pathway will provide laboratory directors with more than 20 continuing medical education credits, in addition to PACE and other CEs for other laboratory professionals. Next slide.
So the CLIA Deficiency and Research Tool, or CDART, is an innovative resource that lets laboratory directors, CLIA surveyors, and other laboratory professionals search and access training and regulations relevant to common CLIA deficiencies and the specifics of the CLIA standard in 42 CFR Part 493, Laboratory Requirements. Next slide.
This CDART tool allows participants to select one or more deficiency codes in a form. When the form is submitted, a list of e-learning, job aids, and video scenarios are presented along with the reference to the appropriate code of Federal Register details and interpretive guidelines. Users will be able to download the results to keep as a reference and as recommended training. Next slide.
LDU will focus on improvements in documentation, quality control and quality assurance, CLIA proficiency testing, unsatisfactory proficiency testing results and unsuccessful performance in proficiency testing, and evaluation of testing systems. Next slide.
LDU consists of 7 learning topics. They are Introduction to LDU, Lab Director Responsibilities, Personnel Responsibilities, the Survey Process, Quality Systems for Laboratories, Participation in Proficiency Testing, and LDU Capstone, which applies LDU concepts to real-life scenarios. These topics are not released in numerical order. Next slide.
For topic 1, this event that we're in right now, Introduction to LDU, is part of topic 1, along with Introduction to Clinical Laboratory Improvement Amendments of 1988, Fundamentals of Quality Practices in CLIA and Provider-Performed Microscopy Procedures, and Ready, Set, Test. The recording of this One Lab Network event will be part of topic 1 on the CDC website. And Ready, Set, Test is currently being updated and will be released soon. Next slide.
The CLIA Personnel Qualifications and Responsibilities for High Complexity Testing e-learning course provides a brief overview of the requirements, duties, and credentials of personnel who perform or oversee high complexity testing as mandated by the CLIA regulations. The course is intended for clinical and public health laboratory staff, as well as others involved in CLIA non-waived high complexity testing across various specialties and subspecialties, and those working with tests that the FDA has not classified into a specific specialty or subspecialty. We offer several continuing education types to learners who successfully complete the course. For more details and to access the course, we will drop this in chat. Next slide.
Coming soon will be topic 3, where we will cover CLIA personnel qualifications and responsibilities, moderate complexity testing, and delegating responsibilities practice example. In topic 2, we will cover introduction to laboratory director responsibilities and the purpose of the CLIA survey. Next slide.
Personnel responsibilities and the survey process are future courses within LDU. Topic 3 will address the qualifications and responsibilities for laboratory director and laboratory personnel. Topic 4 will cover inspection deficiencies and how to complete the form CMS 2567. Next slide.
Topic 5 in LDU will cover quality systems for laboratories performing non-waived testing, including laboratory systems and general requirements, fundamentals of a CLIA quality system, pre-analytic, analytic, and post-analytic systems, the importance of instrument maintenance and function checks, calibration and calibration verification, verification versus validation, performance specifications, specimen identification and integrity, and quality assessment. Next slide, please.
Future courses include Introduction to CLIA Proficiency Testing, which is currently available now and will be part of the LDU course list. Topic 7 is LDU Capstone, and this will provide real-life scenarios. Next slide.
When a patient visits a clinic for a routine checkup, a cancer screening, or a mysterious infection, one of the first steps is often a laboratory test. The provider collects a sample, sends it to the laboratory, and within hours or days, the results arrive. What many don't see is the team of highly trained, CLIA qualified laboratory professionals working behind the scenes to make those results accurate, timely, and clinically useful. At a CLIA certified laboratory, accuracy is not optional. It's a requirement. Every technician, technologist, and supervisor undergoes rigorous education, training, and competency assessments to ensure they can properly handle specimens, run complex diagnostic equipment, and interpret data. Errors in a laboratory can mean a missed diagnosis or a delayed treatment. That's why CLIA sets strict standards for who can perform, supervise, and direct laboratory testing. Next slide.
We want to thank you for attending today's webinar. The website is now live, and please check back often as more courses will be released. We look forward to seeing you in LDU. Next slide.
Okay, we'll take a few minutes to answer as many questions as possible. We'll only address those questions related to today's topic. So if you have any questions or inquiries separate from today's webinar, please contact CMS Laboratory Excellence Team at laboratoryexcellence@cms.hhs.gov. And as always, if you have any OneLab questions, you can please email the OneLab at cdc@gov. So let's see. This is going to be a two-part question. I'm not a laboratory director. Can I take the LDU courses?
Yes. Anyone interested in gaining knowledge about CLIA requirements and regulatory compliance can benefit from taking any of our varied LDU courses. Additionally, I would like to note that while the LDU is intended for laboratory directors, we are also getting PACE credits for non-physicians to earn continuing education credits. Next question, please.
Yes. So with that being said, would the LDU provide acceptable qualifications for becoming a laboratory director?
Yes. Yes. Once the course has been fully released, it will have the 20 continuing medical education credits required by the CLIA regulations.
Let's see. Since the whole program is not completed and released yet, will my CEs count toward the entire program?
Yes, any CE credit hours gained from LDU will count towards the completion of the LDU program for laboratory director certification.
What about, can I retake a course if I don't pass?
Yes, you will be able to retake the course if you don't pass.
So since the 20 courses, the CEs are not accessible, do you have a date when they will be accessible? When the full course will be, the full 20?
Yeah, the full learning plan is expected to be completed and available by the fall of 2028, the full complete 20 credit course.
We'll take another one. Let's see. Okay, this is a good one. One of the things that we have with the OneLab is that we have a lot of our international labs that also join. So this is from an international lab. They said, can they take the LDU if they are not working in the US, but working for a DoD overseas lab?
Absolutely. Anyone, anywhere in the world may take LDU as long as you can sign up for a CDC OneLab account.
Let's see. Will additional job aids be provided for personnel qualifications?
Yes, we will also release additional checklists and other resources such as the job aids over the next few months. And so check back to the website for those items that will be released.
And then I'm going to take this question. Would the class or the LDU provide acceptable qualifications to becoming a laboratory director?
Laboratory Director University will fulfill the 20 CME requirement in the CLIA regulations. However, to be a laboratory director of a non-waived laboratory, there are other requirements that must also be met regarding education.
Okay. And you may not know the answer to this one, but someone wants to know, when will the CDART be live?
I'm not sure when the CDART will actually be live, but absolutely we will follow up with that.
See, that's okay. This is a good one that others may not realize. How will the CEs work, and who will track them?
The CDC website will keep a record of your continuing education credits. You will also be able to print out a certificate for the credit, the course that you just took and that credit. And those credits will be housed, I don't want to say in perpetuity but the plan is that they will be housed in perpetuity on the CDC website, on the One Lab.
Let's see. Here's two good ones. This one we'll actually forward this one over to you. This one will probably take too long to answer. This one, but is the capstone a real project of your organization?
The LDU capstone topic, number 7, will include real life scenarios, and that will be applicable to laboratory situations.
And as always, so is there a cost for the LDU?
I'm sorry, is there a call for
is there
LDU?
a charge?
Thank you. No, LDU will be offered free. There will be no charge for any of the topics, the job aids, the educational resources, the use of the CDART tool, or anything else associated with Laboratory Director University. It is all free of charge.
And we'll take this one last question. Will the CE credits be applicable for MLTs or MLS's certifications?
It will be a part of their continuing education credits. Yes, we are offering the continuing medical director education credits as well as other laboratory professionals.
Okay, that's all the time we have for questions. I want to thank you again, Cheryl and Karen, for joining us and for an excellent presentation. And we look forward to having you for future One Lab events.
Thank you.
Thank you.
Again, if you have any questions today after the presentation, please contact CMS Laboratory Excellence team at laboratoryexcellence@cms.hhs.gov. As a reminder, the audio recording for this event will be posted to our website within 2 weeks from today. And finally, we encourage you to use the One Lab box to share your training needs and feedback with us. We actually rely on your input to choose event topics and better understand the community's need. The One Lab box email address is posted in the chat for your convenience. And as always, we thank you for joining us today, and we hope you have a happy and safe holiday, and we look forward to seeing you in 2026.